Hello everyone. Today, we're diving into the world of a medication called Glyxambi, which is a combination of two active ingredients, empagliflozin and linagliptin. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Glyxambi is an oral medication that combines empagliflozin, a sodium glucose cotransporter 2, SGLT2, inhibitor, and linagliptin, a dipeptidyl peptidase 4, DPP4, inhibitor. Empagliflozin helps the kidneys remove glucose from the bloodstream through urine, while linagliptin works by increasing the levels of incretin hormones, which help to regulate blood sugar levels. Glyxambi is primarily prescribed for the management of type 2 diabetes in adults, in conjunction with diet and exercise. The combination of these two medications helps improve blood sugar control more effectively than either medication alone. Warnings: Glyxambi comes with its set of precautions. It's not intended for those with type 1 diabetes, as there's a potential risk of diabetic ketoacidosis, a serious condition characterized by increased ketones in the blood or urine. It's also not recommended for individuals with moderate to severe kidney issues, as its effectiveness may be reduced and the risk of side effects may increase. Additionally, individuals with a history of pancreatitis or severe heart failure should use Glyxambi with caution. Before taking this medicine. Before starting Glyxambi, it's crucial to consider several factors. Inform your healthcare provider if you have any allergies to empagliflozin, linagliptin, or any other ingredients in Glyxambi. Given its impact on the kidneys, those with kidney diseases or conditions should discuss potential risks and benefits with their doctor. If you are pregnant, planning a pregnancy, or breastfeeding, consult your healthcare provider. Regular monitoring of blood sugar levels is advised for those with diabetes or at risk of diabetes. You should not take Glyxambi if you are on dialysis or have severe kidney disease. It's also essential to inform your doctor if you have ever had heart problems, liver problems, bladder cancer, pancreas problems, high levels of potassium in your blood, or if you are on a low-sodium, salt diet. Inform your healthcare provider if you drink alcohol very often or have ever had diabetic ketoacidosis. If you are scheduled for surgery or certain X-ray procedures with injection of dye, you might need to stop taking Glyxambi for a short time. Side effects: all medications can have side effects, and Glyxambi is no exception. Some individuals might experience dehydration symptoms like dizziness or fainting, especially upon standing. There's also a potential for genital yeast infections in both men and women. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Additionally, there's a risk of necrotizing fasciitis of the perineum, Fournier's gangrene, a rare but serious bacterial infection of the tissue under the skin in the area between and around the anus and genitals. If you notice any signs of this infection, such as fever, pain or tenderness, swelling, or redness of the skin in the genital and surrounding areas, seek medical attention immediately. Another potential side effect is the onset of diabetic ketoacidosis, a serious condition where the body produces high levels of blood acids called ketones. Symptoms can include nausea, tiredness, vomiting, trouble breathing, and abdominal pain. If you experience any of these symptoms, it's crucial to get medical help right away. Furthermore, Glyxambi may cause serious side effects including kidney problems, high blood sugar, hyperglycemia, low blood sugar, hypoglycemia, when combined with insulin or medicines that increase insulin levels, bacterial infections in the skin or under the skin, serious urinary tract infections, low blood pressure, high potassium levels in the blood, increased cholesterol, and bone fractures. It's also important to note that Glyxambi can lead to dehydration, especially if you don't drink enough fluids, if you vomit, or if you have diarrhea. Symptoms of dehydration include dry mouth, thirst, urinating less often, dark yellow urine, dry skin, and feeling dizzy or faint, especially when standing up. Always consult your doctor for medical advice about side effects and report any new or unusual symptoms. Interactions: Glyxambi might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Glyxambi. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended dose of Glyxambi for most adults with type 2 diabetes is 1 tablet once daily, taken in the morning, with or without food. Glyxambi comes in different strengths, and your doctor will determine the best dosage based on your individual needs and response to the medication. It's important to follow your doctor's instructions and not to alter your dosage without consulting your healthcare provider. Avoid. While on Glyxambi, it's advisable to stay hydrated to prevent dehydration. Given the potential for dizziness, it's wise to rise slowly from sitting or lying positions. As with many medications, it's recommended to avoid alcohol, as it can exacerbate certain side effects. FAQ. Many wonder about the age restrictions for Glyxambi. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Glyxambi. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.